Hello, my name is Al Ali, and I'm here to talk to you today about your upcoming experience with your rhinoplasty, what to expect before surgery, what to do after surgery, and kind of long-term follow-up as far as the surgery goes. The first thing is, I'll tell you that it's very normal to be nervous when you're about to have surgery. That's expected. Very much everybody goes through that process. If you have questions about things that I might be able to help you reduce your anxiety with, please ask them. We're able to answer those, and that'll make you feel better. Now, there's a set of medications that we order for you, and I'd like you to pick those up prior to surgery, not the day of surgery, because it's kind of uncomfortable to go to a pharmacy after surgery. So make sure you have them at home. You don't need to bring them to the hospital. Now, the experience that you'll have at the time of surgery is the following. You'll come in, we'll have you sign a few more consents other than the ones that we do in clinic, and anesthesia will meet you. Then you'll go to the operating room. And that's probably the last thing you'll remember till you wake up from surgery. When you wake up from surgery, most likely you're going to have an external cast, which is on the outside of your nose, and then things called splints, which are on the inside of your nose. You probably won't be able to see those, or you may not even think you feel them, but they're also going to be there. So what we'd like you to do after surgery is, number one, for the first 48 hours or so, cold compresses are a pretty good idea. There's a lot of different ways you can make cold compresses. We usually give you something to put on top of your eyes. You don't have to make them very cold. They don't need to hurt. They just need to be colder than body temperature, and you need to keep them on for about 20 minutes out of every hour. You don't necessarily need to wake up in the middle of the night to put them on, maybe once or twice. Cold compresses are only really good for 48 hours, but if you want to use them after that for comfort, don't have any problems with that. Continue to do that. You must keep your head elevated at all times, at least for a few weeks after surgery, especially in bed. You're generally a minimum of at least 3 pillows, and keep your head up, and that will reduce swelling. It'll reduce discomfort. So it's very important to keep up with that. And basically, when you can stop doing that, you just need to ask me when you come back to clinic. Now, generally, we're going to see you at about a week out from surgery. And in that session, we're going to remove your external cast. Most of the time, we're also going to remove your splints. And that's something that we do in a very organized fashion in the clinic. Outside of keeping your head elevated and cold compresses, there are some things that are very important for you to do to help your nose heal and not have any problems. First thing is, you need to use this saline spray, which is basically salt water. It's not really a medicine. And we need you to put it in your nose a minimum of 5 times a day. Now, when you get out of surgery, you're going to have something called a mustache dressing on. So you have to remove that mustache dressing to put those nasal sprays in. The reason it's called a mustache dressing is because it looks like a mustache. You don't need to keep using the mustache dressings once you stop dripping either mucus or a little bit of blood out of your nose. And usually that takes about 48 hours or so. So expect to have some drainage coming out of your nose for at least 48 hours, if not longer. As I was saying about the saline sprays, you need to put them in at least 5 times a day. And initially, everything is just going to come right back out, but enough goes back to keep your nose moist. And that's the purpose of these saline sprays. If you can do it 10 times a day, it's better than 5, but a minimum of 5 times a day. Now, the other part that's really important is that we want to keep, again, the inside of your nose moist, and we want to prevent caking of blood or hardening of dried blood on the inside of your nose. And we want to get rid of the sutures that we use to close, which is on the underside of this area called the columella, also on the inside. The first thing you do is you use hydrogen peroxide on a Q-tip, and you put that on the inside of your nose and roll it. And I'll show you that in clinic before surgery. And I also want you to use that hydrogen peroxide on the sutures that are in the area of the columella here. And you need to do that fairly aggressively. You don't want to just barely touch it. You want to be a little bit aggressive because, again, it helps reduce the caking of blood and it helps get rid of the sutures. So once you touch both insides and on the underside, then we give you a medicine called bacitracin, which is an ointment, and basically put a little bit of that ointment on the clean Q-tip, and again, touch those places. And that exercise you need to do at least twice a day, preferably 3. But if you do 2, that'll be very good as well. Now, when you come to clinic and I take your cast off and take your splints out, most likely what I'm gonna have you do is I'm gonna have you have some pictures taken, then I will reapply tape to your nose. And the reason is noses, once you take the cast off, swell vigorously. And we wanna reduce that swelling, and that's the reason for the taping. I will teach you how to do that retaping because I'd like you to be completely taped for another 7 days, 24/7. So if the tape comes off in the shower and stuff, you know how to put it back on. Now that's at 2 weeks. After that, what I'd like you to do is to continue to tape yourself, but only when you're at home or you're at nighttime. So you don't need to keep it on 24 hours a day. If you really hate the tape, another way to get around that swelling issue is to get something called preparation H, which you probably know is used for hemorrhoids, but it works great to reduce swelling. So get a new tube of preparation H, and if you don't want to use the tape, put it on your nose twice a day, and that will also help you reduce your swelling. Now, people are always thinking, okay, whatever it looks like right after we take the cast off, that's what my nose is going to look like. That is not the way it's going to look. Now, some noses look remarkably different when we take the cast off, but even with those noses, there is a maturation process that takes place. So I would say for most noses, at about 6 to 8 weeks, you have about 60 to 70% of what that nose is going to look like. There is a maturation process. If you continue on, maybe you get to about 70, 80% at about 3 months to 6 months, and about 90% at 1 year. So you can imagine to get the full changes, it takes 1 or 2 years after a rhinoplasty. So basically you have to be patient. If you're looking for things to happen really quickly, it's going to be tough for you. Now, the other thing that I learned over the years is that, we ordinarily look at ourselves in the mirror maybe 10 times a day. When people have their cast taken off, and especially after I have the tape removed, people will tend to stare at their noses 40, 50 times a day. That is not a good thing to do because you'll notice things that nobody else can. And then literally you can find problems that the average person looking at you cannot see. And if you want to just try this out on yourself, look at both your thumbs at the same time with no surgery, 40 to 50 times a day. You'll notice some things that you've never noticed before. The reason this is important is rhinoplasty is one of the most psychologically taxing procedures for the patient. And if you give yourself the opportunity to heal without being overly critical, you'll do a lot better in the long run. So I always tell people you can literally have a great result and talk yourself out of it. So please do not overdo the looking at yourself in the mirror in the post-operative period. We also give you a written set of instructions that repeats everything that I just said, but I think you'll find that this video is very helpful for you. Thank you.